The DC Pediatric Oral Health Coalition is a community-driven alliance made up of multidisciplinary public and private stakeholders who essentially are convening for the purpose of addressing a major critical threat in the District of Columbia pediatric population, and that is improving oral health access. I believe that medical-dental collaboration, prevention and public health infrastructure, and health literacy are the core goals of the DC Pediatric Oral Health Coalition. The medical-dental collaboration is where we get primary care physicians, nurses, and other licensed independent practitioners involved in oral health care. To do this, they would be allowed to provide fluoride varnish application as well as education on oral health and fluoride varnish in the primary care setting.
When the children are born, they have to return to their medical team for their shots, vaccines, immunizations, and they have more contact with the children earlier in years than we do, because we don't really see them until later on, and really we should see them as soon as they get the first tooth in their mouth, but that's not the case. So because the primary care or the medical teams get a chance to have that contact with the children first, we're trying to move it in that direction where they can be licensed or trained to apply this varnish on the children's teeth.
The health literacy component would be targeted towards the parents, caretakers, guardians, and even the academia in schools, so that as we develop a stronger prevention and public health infrastructure system, that is, we have more dentists that provide the fluoride varnish, we have medical doctors that will provide the fluoride varnish, that parents are aware and they understand the importance of this type of preventative health service for their children.
I'm a general dentist. I'm not a specialist. However, I see a large percentage of the 2 to 5 year old children that have high caries risk. The specific core goal basically increase access to oral health care for the children in the District of Columbia, because it's very limited. It seems as though that a lot of the children will only come to the dentist if there's a problem. And the main goal is trying to decrease decay and increase access to oral health care, and that means through the dentist or through primary care physicians and their teams.
The good thing about the coalition is it is made up of the community, and so the coalition members bring this collective voice to the coalition on behalf of the constituents that they represent, so that as part of this collective voice they can be a stronger voice for those 3 primary goals. The community will see a shift, a change in improvements to the oral health system that we have for the District of Columbia, improved access, and increase, hopefully, in the supply of medical professionals and dentists who provide this preventative health services to our children. Ultimately, not immediately, but the next 3 to 5 years, we expect to see actual improvements in oral health.
I believe the DC Oral Health Coalition will benefit the community, one, by increasing the access to oral health care. It has opened up a lot of venues, eyes, parents, teachers, different professionals who have always thought of dental as being separate from medical. Now we're all one team. We're working together as a collaborative for the common goal, and to basically increase access healthcare for the children in the District of Columbia.